spring, I think it was June, when I decided to endorse Senator Clinton. And one of the things that was important to me was health care. We have a health care system in this country right now. It's called health care for some. It's true. Some people get health care, but you can't have a pre-existing condition. Your health care costs can't go up too high, right? You can't be out of a job. If you switch jobs, you better get another job pretty quick. If you work for a small company, that small business owner has a very, very hard time affording health care for you. They're in the same boat as you are. If you pay for it yourself, and then you have health care costs, they call you up and they boot you out. Or they increase your premium so much that you can't afford it any longer. That's the kind of health care we have in this country. And so when I looked at the health care plans of the candidates, it was very important to me that there would be health care for all, for everybody, not for some. We have that. We have health care for some. I wanted health care for all. I kind of dismissed the Republican plans, and I dismissed them because they don't talk about access to health care. They talk about paying for health care. They talk about health care insurance. That's a payment mechanism, and I'm not interested in talking about paying for health care before I talk about access to health care. Because when you have everybody in the health care pool, your prices go down. So one of the things I think is important about Senator Clinton's plan is that everyone has access. Now, some of you might feel that's too expensive. We can't do that. Not everyone can have it. Well, let me ask you this. Who should not? Your children? Your parents? Your neighbors? Who? Who would you put off the list? And if you felt comfortable, if you said, well, you know what, I don't think that person led their life correctly, or I don't think that person deserves it. I feel okay. I have health care today. What about tomorrow? Because when you start taking people off the list, there's always a chance that tomorrow you'll be off the list. When we talk about health care in this country, we need to talk about health care for everyone. And that's one of the reasons I support Senator Clinton's health care plan. Health care for everyone.